why don't you tell the audience a little bit about your background and what gives you the credentials to discuss this topic?
And then dove deeply into the functional medicine realm. I was one of the first doctors that became certified in stem cell therapies at the American Academy of Anti-Aging Medicine, and I've been a member there for probably the last 14 years. Mm-hmm. I've had a personal problem with glaucoma. Mm-hmm. So I've had that for probably 34 years. And that was one of the main reasons, as I had a decrease in visual acuity in one of my eyes after a surgical procedure. Focus on looking at root causes for what was happening to me. So being on the traditional medications and having the traditional surgeries and so forth, it became very frustrating and evident that I was basically on a course that was not going to help reverse this. And of course, right, the traditional ophthalmologists were stating that it's you can only just slow the process down with the medications and so forth. So then after that, really kind of delving into the functional medicine arena, identifying numerous things that were occurring to me as well. And addressing those from a functional medicine standpoint, which is, again, that's root cause, rather than just trying to address something with a medication and so forth. What is driving the disease process? And that's what functional medicine is all about.
Right. So as of today, you're still seeing patients on a fairly regular basis, though.
Absolutely. Absolutely. Being a member of the American Academy of Anti-Aging Medicine, also a member of the Institute for Functional Medicine, and going through all of those programs and learning a great deal. One of the first doctors to do stem cell procedures, started to treat other patients for a wide variety of disease syndromes, diabetes, autoimmune issues, gut issues, thyroid issues, skin issues, a whole host of things. So, and that became very, very fascinating to me that that there were so many ways to address these disease syndromes and reverse them very judiciously in most instances, and some were more recalcitrant than others. However, once one would be open to going on that journey, they would certainly get significantly better, if not totally abate their symptoms. About 6 years ago, I really became enamored with one of the first health summits that came on the scene, and that was the Gluten Summit. And that was Dr. Tom O'Brien, and just a fascinating array of information on how gluten was a major cause of multiple disease syndromes and so forth. And out of that summit was birthed a whole wave of different summits and so forth. And one of the ones that really caught my attention probably about 5 years ago was the Alzheimer Summit, where I met you. And the topic that really made an impression on me was when you said that glaucoma was Alzheimer's of the eye. And then that's when I contacted you and said, I have to know more about this about this situation.
It's not well published, but I think it's very clear that the mechanisms overlap. I mean, people don't realize that certain eye diseases are neurodegenerative diseases, just like Alzheimer's, and that's the overlap. So they share a lot of common factors. So
absolutely.
So since then, you became, in my opinion, one of the most well-trained practicing clinicians in brain health. And maybe you can describe the two programs, Dr. Tremp and Dr. Bredesen.
Yes.
That you are fluent in.
Yeah. Well, with you and Dr. Clement Tremp out of Harvard, and you, of course, being out of MIT and Harvard, writing the first book, The End of Alzheimer's, and with main focus of that really elucidating the subacute infections
Right.
that were a major causative factor of Alzheimer's and eye diseases and a whole host of other things that really, Dr. Tremp started this some 20 years ago, treating patients and so forth. And he found that a number of those individuals who had various eye diseases, such as glaucoma and macular degeneration and what have you, he was the only doctor that I knew of that actually tested people's blood. So to date, there probably are just a handful of ophthalmologists, and on one hand, probably you can count that actually test people's blood at this point. And we're talking about very, very recent now, because there are a few that get it and look at the functional medicine realm to bring into their practices and so forth.
And knowing what to test in the blood.
Absolutely.
Very, very important. It's not, a lipid panel is not going to help you understand the root causes of cataract, macular disease, or glaucoma.
Absolutely. And, the elucidation of those subacute infections like Lyme disease and toxoplasmosis and mycoplasma and chlamydia pneumoniae, reactivation of Epstein-Barr virus, and a whole host of others are not appreciated as causative factors because they don't cause you to have, fever or chills or anything like that. You don't necessarily feel bad. I mean, sometimes, one can have the beginnings of chronic fatigue syndrome and so forth, but it can masquerade as so many things. And even when you get your standard labs and, the doctor looks at the white blood cell count and it's in the traditional normal range, there's no red flag raised to say that something's going on. And that's a real issue with these occult infections, that they sit in the background very stealth and just chew away at you.
Dr. Carter, I have sort of a little metaphor for that. We all know about periodontal disease, and you have bleeding gums, but what is really happening under the scenes, behind the scenes rather, is that the bone is being eaten away by these organisms, and that's why you keep loosen up and all that. But you don't really feel badly if you have periodontal disease. You might have a little jaw pain, or you may not even have that.
Right.
And if I ran your white blood cell counts and looked at other biomarkers, they may not even be elevated.
Absolutely.
Let's say that exact same process was happening in your joints, in your heart, in your brain. How would that manifest into disease? And it could be something as severe as Alzheimer's disease, but
absolutely,
a very localized infection that seemed to be of no particular significance. That's a big problem. So tell me about your Bredesen training.
So after being trained by both you and Dr. Tremp, then Dr. Bredesen's training program came out probably about 3 years ago.
Right.
And to date, he's trained about a little over 1,000 doctors. And he's very well known. He's a neurologist at UCLA and the director of the Buck Institute. And he wrote the second book, The End of Alzheimer's. And basically elucidated 6 different main underlying causes for Alzheimer's. And even though he is a classically trained neurologist, he and did a lot of lab work. He found during all of these studies and so forth, with the influence of his wife and other doctors in the functional medicine arena around him, he determined that truly there is no one cause of Alzheimer's, and it certainly is not amyloid.
Right.
So he opened up even more credibility, shall we say, in the realm of multiple reasons for Alzheimer's.